At the Animal Emergency Service on the Gold Coast, Nathan and Natalie have brought in their German Shepherd cross, Ralph. He's had a nasty encounter with a fishhook.
Are you guys all right to bring him through?
Yeah.
Okay, all right, yeah.
All right, come on, Ralph.
Let's go, Ralph.
6-year-old Ralph has a fishhook caught in his tongue, and they're hoping Dr. Alex Hines can remove it.
He's obviously licked the hook because the hook had no food on it.
No.
So he's licked it, but in licking it, he's caught it in the left side of his tongue. So we could see where it was, and it hadn't gone all the way through.
Thank goodness he didn't swallow it. That would have been a whole different story.
Yeah.
Hey, Ralph. But it's obviously irritating him because he keeps trying to lick it. For Ralph to get a fish hook through his tongue, that must have been so painful. Apparently, he let out a huge yelp, and I don't blame him. It's not a great situation, but yeah, it could have been much worse if he'd swallowed it. What I'm going to do for him is I'm going to give him a little bit of pain relief, and it'll also act as a bit of sedation as well, because he's pretty anxious here now.
He's an anxious dog anyway.
Is he?
He's on tablets every day.
He's on a plan for anxiety, basically, in dogs.
Takes anti-anxiety medication
Yeah.
every day.
We'll work out a plan of how we're going to get that hook out of there.
It's all right, Ralph. You stay here with us. You jump in. Jump, Ralph.
Ralph is like, I'm not moving. You're all right, Ralph. Good boy. You see Mum and Dad soon. It's okay. Good boy, Ralph. I think we're going to have to go very slow and steady with this boy because he's just anxious. And look at him, he's just looking back for his mum and
Super
Dad.
anxious, aren't you, Ralphie? Hey?
Oh, that's got to hurt. It's hard to actually tell whether it's gone through his lip or it's actually into his tongue because he keeps moving around. It could have been much worse. If he'd swallowed the fish hook, we'd be trying to get it out of his stomach. The fact it's in his lip, this isn't a great day for Ralph, but it could be worse. All right, well, let me get him some pain relief.
Yeah.
Give him a good dose because he's going to need something. He's a very worried boy, aren't you? You're a very worried boy.
It's all right.
Good boy. Doesn't hurt nearly as much as that fish hook, does it? At this stage, the plan's probably going to be to get Ralph nice and sedated, and then we're going to need to try to remove it, probably with a pair of bolt cutters, actually, to snip through the fish hook and remove it. If it does go through his tongue, it's going to bleed quite a lot because the tongue bleeds. So we're going to need to control the bleeding, get the fish hook out.
There you go.
But he's probably going to need some heavy sedation. He's not just going to let us put our hands in there and pull it out. Hey, Ralphie. It's your turn, mate.
At the Animal Emergency Service on the Gold Coast, 6-year-old Ralph has a fishhook stuck in his tongue.
Oh, good boy. Yeah, I don't know quite how we'll go on this bench because he's a bit of a worry wart.
The German Shepherd cross suffers from anxiety,
Right.
Good dog.
so he'll need to be put under a general anaesthetic before Dr. Alex and vet nurse Lee can start trying to remove the hook.
At the property where Ralph lives, he looks after the ducks, the chickens, the geese, even the kids. He takes his job very seriously. In fact, he's on anti-anxiety medication because he's just constantly on the lookout. He is such an anxious boy, they really want to have him home tonight.
Yeah, okay.
Because they just don't think he'll cope with a night in hospital.
Yeah.
And even now, he's just
He seems real stressed.
really stressed.
You're okay, mate.
While Alex tries to calm Ralph down, it's a nervous wait for his owners, Nathan and Natalie.
He was in shock, but then he was bouncing up and down, like he was, what's going on? Why is it hurting? And then he would start crying, and then, of course, there was blood coming out of his mouth.
Good boy. There you go. Are we ready? Little sleep? Hopefully when you wake up, it'll be all gone. Good boy.
With the sedation taking effect, Ralph finally starts to relax.
He's taking a lot of anaesthetic, I think just because he's so wound up.
Yeah.
It's taking a lot just to get him to sleep. Off you go. Good boy.
Do you want help flip now?
Dr. Alex has been debating exactly how to get the fishhook out safely and is keen to get advice from colleague Dr. Lachlan, who's done similar procedures in the past.
Ralphie's got the fish hook and it's actually in the tongue, but the barb's not out the other side. So I was thinking of pushing it through so the barb's out and then cutting off the barb.
That technique certainly does work,
Yeah.
and I have seen that being used. In my previous job, I have seen quite a few cases similar to this, and
Yeah.
one of the other vets out there showed me a technique which is relatively not so traumatic of having to push it through the other way.
Yeah, okay.
And sometimes it works pretty well. So I can't guarantee it'll definitely go to plan, but I'm thinking that usually it's always worked very well for me in the past. And if
Yeah.
you want, I'm happy to show it to you tonight.
Yeah, well, can you describe what you do exactly?
Yeah, sure. So if we can imagine this is our tongue here, okay? And we've got this fish hook coming in through this point here. There's
Yeah.
our little
Yeah, that's
barb.
pretty much what it is, which is, yeah, it's embedded in the tongue.
Okay,
Yeah.
so either you've got to try and push that all the way through to the other side, clip it off, and then get it all the way out.
Yeah.
The other alternative, how I've sort of managed it, is essentially we get like a pair of either needle drivers or forceps, and
Yep.
basically grab a hold of this section here, okay, with that, and then pretty much in exactly 180 degrees the other way, we just get a bit of suture material, and we wrap that around this point here.
Okay.
And now, with this side, while we're stabilising this,
Yep.
we're going to pull very quickly and firmly
In that
the opposite
direction.
direction the other way. And we see, for some reason, it just, with the barb hook, it seems to cause less trauma, and it can usually come out in a matter of a few seconds once we get it going.
Really?
Yep. Well, we'll see how it goes tonight if you're happy to give it a go.
Yeah, I'm happy to give it a go. And yeah, I've never seen that done before, but if that works, yeah,
Cool.
let's do it. Let's give it a go.
Excellent.
God, look how swollen it is. That's nasty. Oh, that's going to be sore.
It's going to need a good flushing afterwards for sure.
Yeah.
Alex is intrigued to see if her colleague Dr. Lachlan will have a magic solution when it comes to safely removing a fishhook embedded in Ralph's tongue.
So how I'll get you to maybe hold it for me,
Yep.
because I'll probably get,
Yeah, you tell me what you need me to do.
almost just hold the tongue for me like this.
Yep.
Okay, then I'll essentially have one hand on it here, and I'll be wrapping the other bit here, and I'm just going to go like that the other way.
Not going to stick the fishing hook in my hand.
No, I don't think so. We stand in the right direction. It should be nowhere near.
All right.
I think it should be safe.
Okay. Yeah, cool. Let's do it. You feeling confident?
We'll see how we go.
Alex was thinking about cutting the hook, but Lachlan's technique involves holding the shank end firmly, while the curved end is pulled in the opposite direction, causing less damage as the hook comes out.
I'm really glad that Ralphie's asleep. I don't think he'd put up with this if he was awake.
No, definitely not.
This is not pleasant. All right.
All right. So, when I say 3, 2, 1,
Yeah.
we're going to pull.
Okay, just a minute. Yep, okay.
You got it? And 3, 2, done. Out.
Oh my goodness. Look at that.
Down to one go.
Wow.
Now it just needs a really good flush because there's still going to be some nasty sort of bacteria in there, but you can see pretty easy with not too
That
much
was
trauma at all.
really good.
Dr. Lachlan has managed to remove the hook cleanly, leaving the German Shepherd with a good chance at a quick recovery.
I'm so impressed. When Lockie first told me about this technique, I wasn't sure it was going to work. It sounded a bit dodgy, but sorry, mate, but I didn't know. I've never seen anything like that done before. Normally, we push the hook through and we cut the barb off, and basically in doing that, we're creating another hole out the other side of the tongue. But with Lockie's technique, we're able to pull it out, and Ralphie's only got the one hole.
If we can find an easier way to do things without more complications, absolutely. And it's worked for me just about every time, so keep doing it.
Yeah. Good job, mate.
The next important step is a saline rinse to clean the wound and help reduce the risk of infection.
It's heaps, eh?
Yep.
All right, cool. I can wake him up.
All right.
That was incredibly impressive. I can't believe he just pulled it out. We've got one hole. I reckon that'll heal up in no time. That looks really good. Hey, Ralphie, you go back to guarding your family. Ralph just needs a little bit of time to wake up. It's nearly midnight, but I've just heard that the whole family are coming down, even the kids. There's no way they were going to stay away. All right, back to bed? Back to bed. All right, come on, Ralphie, let's go. Hey, Mr. Ralph. You're looking good. You ready to go home?
On the Gold Coast, Ralph has woken up after the fishhook removal surgery.
I'll get that
and he's well enough to go home.
The whole family wanted to be part of this reunion. Natalie put the kids to bed, set the alarm and woke them up so they could all come down tonight.
He's a lovely dog, absolutely.
He adores my family.
Come on. Come on, Ralphie.
He does his job in terms of protecting
He adores
them,
all the
and
animals.
He's very good with the kids, and that's all we can ask for.
Hey, baby.
Hey, buddy, how are you?
Come here. Oh, hello. How you doing? Hello.
I missed you.
It was such a lovely moment to see Aiden with Ralphie. It was Aiden's fishing rod that Ralphie got hooked on, and the poor boy has been so worried all day that he nearly killed his best friend. What do you guys think?
He's amazing. He's a very awesome dog.
It's all right, buddy. He takes cuddles and hugs very well, doesn't
He does.
These cuddles.
Very important. The centre of attention.
All that's left now is to take Ralph home so he can get back to work guarding their menagerie of farm animals.
Aiden, can I say goodbye to him? Yeah?
See you later, Ralphie.
Hey, be a good boy. You look after your family because they love you very much. Hey? All right, you guys take him home?
Yes.
All right.
All right.
Thank you very much.
See you later.
Bye-bye.
Yeah.
Thank you so much for
welcome.
everything.
No worries, Nat.
Hi, I'm Dr. Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.